Well, we do have a quorum, so I think we can call our meeting to order and get started. I think we're probably going to have a pretty full agenda. We have a lot to review. I hope everybody had an opportunity to do so. But before we start, I'll go through our public meeting guidelines for today's meeting and all meetings. And I'm starting out to state our names and role. I am Greg McMahon, Liaison ARPA for DDS. And members of the meetings of the ARPA Transformational Advisory Committee or public meeting is defined by the Freedom of Information Act and should follow the following guidelines. As a public meeting, it's held virtually. It's going to be recorded and made available to view on DDS's website. Committee members must make a good faith effort to state their name and title each time they speak during the meeting. If a committee member would like to speak, please raise your hand and one of our co-chairs will acknowledge you. There's no public comment portion to this meeting. Members of the public are able to join, watch, and listen only. So I believe our first order of business for the day is to review and approve minutes from the previous meeting. So if everybody's had an opportunity to review, are there any updates, changes, recommendations to the minutes as they were written? All right, hearing none, I entertain a motion to approve the minutes.
Joanne Melise, Living Innovations, motion to accept.
A second from anyone?
Denise Palladino, South Region SD Director, second approve.
Okay, thank you. So we have a motion to approve the minutes. All those in favor indicate by raising your hand or saying aye. Anybody opposed?
Aye.
Okay, don't hear any opposed. Any abstentions? Okay, hearing none, that motion is approved. The minutes are approved, and we can get on with some business for the day.
Excuse me, Greg. This is Shannon Giacovino, DDS Ombuds person. Can I just ask the person who's calling in at 860-989-2497 to identify themselves?
Sure. This is Maura Fitzgerald, and I work with McDowell Communications Group.
Oh, hi, Maura. Thank you.
Hi.
Okay. Just a quick couple of updates before we get into reviewing the employment and day incentives. One is in regard to Maura Fitzgerald, who just joined our meeting. We have finalized our work with getting with our communications group, and Maura represents McDowell Communications, and they are going to be working with DDS and the committees in order to better communicate messaging to both families, staff, and all stakeholders. We are going to be starting with a meeting with the two engagement committees, DDS and individual and family, for the chairs of those committees. So Shannon and I, along with the chairs of the DDS committee, to have an initial meeting to make sure that the messaging that both of those groups are beginning to form are consistent with one another. We have different audiences, but very similar need to be consistent in how we message. So I believe Maura or representatives from McDowell will be joining meetings on a fairly regular basis in order to know what we're up to and how to help us best communicate our messages. So welcome. I'm not sure at this point for Maura's participation, probably represent a member of the public at this point. So the rules around our public meetings would apply, that you're able to watch and listen only at this point until we add you to the agenda.
Excuse me,
Um,
Greg. This is Shannon Jacobino, DDS. I'm Bud's person. I'm just asking the person who just came in at 860-247-9100 to identify yourself.
Hi, yes, Rebecca Brockway from McDowell Communications Group. Good morning.
Hi, Rebecca. Thank you.
See, a couple of other updates from the last meeting. They question asked about CCH and incentives, and they're not formed yet. They're not as straightforward as some of the provider incentives because there may be issues around giving more income to CCH providers, especially in terms of tax-free stipends and a lot of other complicated factors around CCHs. So, but I raised that, and they're looking at how we can best incentivize CCH providers and individuals and families as they relate to CCH providers and regular providers in order to come up with a similar structure to what we reviewed for residential last time. But it's not quite as straightforward, in part because of how CCHs are paid. And we also, in relationship to that, another question last time was around self-direction incentives, and I have raised the question around whether we can incentivize certain goods or services because we're not able to provide financial incentives to families. So that is kind of also a work in progress and trying to figure out how to work through those. Joanne, I see you have a question.
Yes, thank you. Joanne Melise, Living Innovations Director. A lot of the questions that I have in reviewing the materials had to do about CCH incentives, whether it be to the individual home providers or to the agencies for recruitment. As it stands right now, the rates that private agencies are compensated is way below the amount of work that has to go into them. So I know you don't have answers right now. I appreciate you following up with that, but that's a real roadblock for me in terms of this is a residential model that the state wants to enhance and offer more of, yet sorry about that. Yet they didn't come through with some real clear incentives to support that model. So thank you, Greg, for following up.
Okay, and this is Greg McMahon, TDS. I don't know because they haven't formulated it ultimately yet. There's a couple other services that are a little more complex that are being worked on. I think that what might be the easier part of CCH incentives is incentives to providers who do CCHs. The harder part is if we can incentivize individuals and families in some way, and that's the harder part, that trying to see, similar to self-direction, whether there's a way to also make that incentive a little more meaningful to individuals and families. So I think the agency piece will probably be a little more straightforward.
Joanne Melise, Living Innovations Director. Yes, Greg, I do agree with you. I'm not sure that they need to be tied to each other, but I would love to see what their proposals are. And Greg, if you know that if there's somebody that I can help work with on that, I would be welcome to join that conversation. So thank you.
Okay, you're welcome. Those are all the updates I had. This is Greg McMahon, DDS. All the updates I had. Shannon, did you have anything else we've talked about that I might have missed?
This is Shannon Jacobino, DDS. I'm Bud's person. I don't. Thank you, Greg.
Okay. So the next item on our agenda is to review the incentives. We did go over the residential incentives when we met last time, so I think we can start with those because I believe people have seen them a little bit more, and we went through the PowerPoint last time. I believe we had asked if folks could think about anything that may have popped into their mind that they didn't ask when we reviewed them. So if we could start with that, would it be helpful if I put them up? Okay, give me a second. This is Greg, TDS. Can everybody see that?
Oh, Greg, this is Shannon Giacovino, DDS. I'm Bud's person. The next item on the agenda was actually to review the employment and day incentives, which we haven't done yet for the committee.
Okay, I'm sorry, I misread that on the agenda. So I'm going to close this and open the day and we'll go through that. Sorry about that. Okay, can everybody see those? Okay, this is Greg McMahon from TDS. Shannon and I we'll go through these and review them as we did the the residential incentives the meeting before last. And feel free to ask questions as we go or at the end or anywhere in between. So in terms of items that are eligible for incentives with, again, the incentive initiative is to move people from congregate to more independent or group settings. So the things that would be eligible for incentives are DSO to group supported employment, day support options or DSO, which is an in-house day program, DSO to full-time ISC, independent supported employment, DSO to part-time ISC or part-time GSC, DSO to competitive employment, and individualized day, GSC to full-time ISC, I think that's repeating itself, GSC to part-time ISC and part-time GSC, which is also repeating itself. I'm looking at as we go through this. And anyone going from part-time GSC to full or part-time ISC, DSO to self-direction, self-determination, DSO to transition services, and DSO to project search. So those are all the movements eligible for incentives. Most of them would be people who would be leaving a DSO, but we are also incentivizing people who get into employment either to a GSC or to individualized employment, project search, etc. So the incentives are intended to be for 200 people through the ARPA funds that we've been granted to move out of a congregate setting. This is also going to be done in phases. There'll be a voluntary group who's maybe stepping up in order to get going right away, and we have others that may move forward at another time. I'm sorry about that. So the provider transition incentive is that if a person leaves a congregate day setting, the provider will continue to be reimbursed as after the person leaves to help maintain the structure and of that previous program. There'll likely be other people still in it, at least initially. And that amount is equal to the daily amount they had previously received. So they would be essentially getting double the payment, or they would be getting paid to maintain that bed. Excuse me, it's not double the payment. And that is for 4 months. The new placement provider is the person who's taking the individual into a new, more independent setting. So if they're coming from a DSO, for example, into a more independent program, they would get the standard rate and an additional payment equal to that standard rate for up to 30 hours a week for 6 months. And an individual moving to ISC would get I can't read that corner of the screen because the picture is there. So sorry, everybody, my screen froze for a second.
This is Shannon Jacobino, DDS ombudsperson. We can see it, Greg.
Okay.
Yeah.
Shannon, could you review that bullet? I can't see it. I have
Sure.
something in the way here.
Sure. Shannon Jacobino, DDS ombudsperson. An individual moving from a congregate day setting to ISE or customized employment will receive additional funding over and above the standard rate. In addition to the standard ISE or customized employment rate, the provider will receive an incentive amount of $71.50 per hour for each hour the individual receives supports and the new placement up to 25 hours per week for 6 months. That's the end of the slide.
Thank you. All right. So we were provided some examples. If two individuals will be transitioning from a DSO, one individual going into a GSC, and one who wants a competitive job in the community with individuals who have lawns of 5 and currently receive the same amount of funding. The provider transition incentive, so the place that the individual is leaving, the provider would receive an incentive payment of $20.08 for the average number of hours that the individuals attended the DSO. It's equal to the support rate that they had been receiving before. So the person leaves, they still get the payment. The new placement incentive for the person going to the GSE would receive the standard GSC hourly rate for a person with a lawn of 5, which for one person is $20.08. In addition, they'd receive an incentive payment equal to that for each hour supports provided to the individual up to 30 hours for 6 months. The new placement incentive for the standard customized employment rate of hourly rate of $65 for the individuals who wants to be in competitive employment. They'll receive their regular hourly rate plus a incentive payment of $71.50 for each hour worked. I still have the screen blocked off, Shannon. I can't quite read the right-hand corner, bottom corner, but and employment supports are provided to the individual for up to 24 hours per week. I think it says 6 months under there. This grid kind of spells out what we just talked about and kind of totals up the numbers. So individual 1 leaving a DSO who has a lawn of 5, the provider they're transitioning out of would receive $20.08 for 6 hours a day for 4 months, which would be $9,036 for each of the 2 individuals. The person going into the GSC would receive the same amount. This is the incentive amount of $20.08 for 6 hours a day for 6 months. And the person going into customized employment would receive the $46,000 and something change. I can't see that again. For their as an incentive for being into a competitive employment setting. And I apologize, I'm having a problem with my screen and that I'm kind of mumbling through this. But that is the whole incentive, that is the whole overview. And I'm happy to entertain questions, clarifications of my rough presentation.
This is Shannon Jacobino, DDS ombudsperson. I don't see anybody with their hand raised or anybody who seems to have any questions. Oh. This is Shannon Jacobino, DDS ombudsperson. Adriana has her hand raised.
Good morning, Adriana Ramirez, Connecticut Family Support Network. I just wanted to ask, of the 200 individuals, how are they being picked, and is it over a span of time?
This is Greg McMahon, DDS. You broke up as you asked the question, at least for me. Could you repeat that?
Oh, sure, I apologize. Can you hear me now?
Yeah.
Okay. I was wondering about the 200 individuals that'll be like, I guess, piloting or beginning the process. How are they being picked and over what span of time?
Okay, this is Greg McMahon, DDS. Their providers are going to be submitting transition plans that they will identify along with individuals and families, those people who they want to move forward. And that transition plan will be presented to the department to make sure that it's person-centered, that it meets the requirements to receive incentives. And we're just in the process of developing and finalizing a draft transition plan that agencies can use. And I'm not sure to what degree we've discussed this, and if we have, bear with me, but I mentioned earlier that there are phases. There's 2 phases to the transition to the that we're moving through. One is a voluntary, asking people if they want to step up now before we've developed, fully developed the transition plan and kind of get started. And that's what we're calling phase 1. And McDowell group has been working on with DDS on formulating that, what a transition plan would look like for phase 1. And agencies would complete that transition plan outline or template, and that would be forwarded to DDS for review and approval, so that they could move forward with a transition plan. Phase 2, which will probably start early to late spring, is going to be a requirement for agencies to submit a transition plan to the department and to continue to work to move forward. And we're hoping that lessons learned in phase 1 will help inform phase 2. So that's the 2-phase process. So if you hear me or others talking about phases, that's where we're at. There are some providers we think are pretty eager to kind of just get going. And we have, there has been one submitted, which I don't know that I ought to say who yet, because it's still just received. But one agency has already submitted a transition plan. So that's kind of what the phases are about. And that's how folks will be, I guess, selected. They'll be selected by the agency itself. I apologize. It's a very long answer to your question.
This is Shannon Giacovino, DDS on Bud's person. I know that the document, the transition document hasn't been finalized yet, but in the draft, there is a section where providers are going to be required to talk about how they have engaged families around the conversation. So a provider isn't simply making a decision that they're going to make this change without any consultation with family, with their staff, and with the individuals that they support. So that is part of the requirement. It will be part of the requirement that providers have to demonstrate how they've engaged people around the change.
Thank you. This is Adriana Ramirez with Connecticut Family Support Network. I do have a part 2 on that. I wanted to ask, when we talk about the providers making the change, so I'm just assuming, but I just wanted to verify that providers are looking to also transition individuals.
Excuse me, Adriana, this is Shannon Giacovino, DDS on Bud's person. You're really breaking up.
Oh, sorry.
Yeah, I don't know. I don't think you have your camera on. Sometimes that helps. Is it possible for you to maybe put your question in the chat or maybe try again?
Yes.
This
No,
is
I'll put
Greg
it-
McMahon
yeah.
from DDS. We might also ask everyone else to turn off their mics. That might help make her, Adriana, a little clearer.
Yeah, no, that's okay. I'll type it in the chat. It's a longer question, but no. worries.
Adriana, this is Shannon Giacovino, DDS ombudsperson. It's much clearer now that the mics are turned off. So why don't you give it another shot?
Oh, okay. Thank you. I wanted to ask about the providers when we say that they're transitioning individuals from, let's say, GSE to ISC. So are they transitioning them into new programs or ICs that they're developing within the organization, or are they transferring to other providers? And will they have these new opportunities available so that way if they do transition, people are starting right off the bat in these new programs?
This is Greg McMahon, DDS. The individual plans for each agency will be maybe very different one to the next. So they're going to be individualized to the agency, so I think that I don't. Actually, could you repeat the rest of your question? I'm sorry.
No worries. The basic question is, I guess, knowing the lack of staffing and everything else, are we picking 200 individuals, but are we prepared as providers to be able to fill the need for these 200 individuals? Whereas right now, the way things are, a lot of programs don't have enough staffing or enough resources to do so. I'm wondering, I know there's a transition plan, so I'm assuming the transition plans from the providers are stipulating that they are ready to receive that many total individual, that they have that many spots open to do that transition before those people are picked, I guess, is what I'm wondering. I don't know if that's clearer.
Okay. I mean, the provider's transition plan will need to outline how they intend to move people and what safeguards they have in place and how they're going to make that work. They have to identify how they're going to meet the staffing needs to make the transition. I don't, initial plans from the agency may not define where each individual is going to go exactly, because they'll be talking about the overall plan from the agency. Concurrent with this, and also in the plan, is addressing individual, there will also be individual plans. So, for each individual that will, as Shannon had said earlier, will involve individuals and families and guardians in making discussions on how best to make that transition work. That's where I think we'll get into making sure that the needs of the individual in the plan are met. But what the initial transition plan for the agency is going to be a bit more global. To start saying that they have a certain GSC and they have identified a place where the person can go. Our hope is the transition plan will spell out where people are going to go and how they're going to do it in a way that would give us confidence that it's going to meet the needs of the individual. Otherwise, it probably would not likely be approved.
This is Shannon Giacovino, DDS ombudsperson. And Adriana, it is possible for providers to partner on this, and for the plan to include people receiving supports from another provider who can provide that service. So that could be a plan that a provider submits, but it's hard to know upfront what the plan will be because each provider will be submitting their own plan.
This is Greg McMahon from DDS. That's the same situation applies to the residential incentives as well. They can cross over agencies. Somebody can leave one agency in a CLA and move to a cluster IHS setting with a different provider, and the new provider would receive the receiving incentive and the old provider would receive the transition incentive.
Thank you.
This is Shannon Giacovino, DDS ombudsperson. Are there any other questions about the employment and day incentives? I don't see any. Greg, the next item on our agenda is to review the Moving On Transformational Initiative document. That is a long document.
Yes.
It was sent to everyone, and so I'm wondering if the committee is okay with it, if we could just ask if there are any questions about that document before we move on to discussion and feedback on all of the things that we've reviewed. And this is Shannon Jacobino, DDS on Bud's person. And, you know, it is a long document. We are being asked right now specifically to give feedback on the transition safeguards that are in place. So maybe it might make sense to put that document up, Greg, and review the safeguards.
Yeah, I'm working on getting it up in the Scrub McMahon DDS. I'm working on getting that up now. This is Greg McMahon, DDS. Can everybody see this?
Shannon Jacobino, yes, we can see it, Greg.
Okay. So the section that Shannon was referring to in regards to safeguards is a bit down toward the end, or as we're going through. So this is the section of transition safeguards. This was actually Peter Mason worked on this initially, and in response to, I think one of the most important questions being asked is, well, you know, how are we going to safeguard individuals and families to make sure that things work out for them, and how do we manage it if some of the transitions we work on don't work out as people hope they would. So he had worked to develop these plans, safeguards. Going through them, all safeguards should be person-centered, and that any timelines around the moving are based on the needs of the individuals. If additional supports are requested by the team, they may be granted in order to help make the transition to the new setting work. If the person is in a new setting and they just need something more on an annualized basis to maintain that setting, the provider and DDS will work together to provide annualized funding to make that work. In other words, if somebody just needs a little something more as opposed to going back, annualized funding could be granted for that. The individual will be allowed to return to the setting they left within the first 60 days if things are not working out. If after 60 days, again, things aren't working as hoped, they'd be allowed to return to their previous support type. So if we're talking residential, if a person left the CLA, but after the 60 days, they said they needed to go somewhere or go back to a CLA, they would be able to go back to a similar setting, but we wouldn't be able at that point to say for sure they'd go back to the same setting, because it may be a very different setting at that point. Either the agency may have decided that they can close a CLA, or they may have taken people in with a very different profile from the people who were there before that may not make it the best setting for that person to go back to. So after 60 days, we would be saying they can go back to the same type of setting. After 120 days, up to a year from the date of the transition, they could go to another setting with funding up to the annualized authorized amount that they transfer, or their lawn amount, essentially, to go back to another setting. The Pratt team, Planning Resource Allocation team, will authorize the funding on the support type they need, so they can move back after all other support options have been exhausted. After 1 year in the alternative setting, the person would go through our regular prep process to move in seek openings as they do now. And anybody who is identified to transfer to another setting does have appeal rights and rights to use the transfer policy if they have concerns about a move that's being recommended. So these safeguards were put in place so that hopefully individuals and families would know that they, you know, if they make the decision to move, they're not necessarily stuck there if things aren't working out, but that they have opportunity to move back. Hopefully that will may encourage people to move forward with a little more comfort as they do so. So this is a section of this document that really is a family and individual oriented section. So we did want to hear some feedback if you have it on this as well.
This is Shannon Jacobino, DDS ombudsperson. Maybe it makes sense to do all discussion and feedback on this part and then move into the residential and day incentives after that. I see Jessica has her hand raised. Jessica Sundell.
Hi, yes, Jessica Sundell, DDS. I was just wondering, I see some of the safeguards that were put in place in terms of supports, but has any consideration been given to people who are going to move out to an independent setting or a cluster setting in regards to like lease arrangements and how that might look? I just worry that somebody might enter into a 12-month lease, and if it doesn't work out, they might be stuck paying for you know, for a rent in a place that they're no longer living.
This is Greg McMahon, DDS. I haven't heard that specific question addressed, and it's a good one. I will bring it forward. I'm sure I shouldn't. I'm pretty confident that with discussion on that, we would find a way to make sure that worked for the individual as part of this incentive. But that's a very important point, and I'll bring that up to the residential committee.
This is Shannon Jacobino. Shannon Jacobino, DDS ombudsperson. Joanne Melise has her hand raised.
Hi, this is Joanne Melise, Living Innovations Director. I'm just going to be that persistent gadfly, Greg, and just add in, what about CCH here too? Will people be afforded the same safety net? Thank you.
Yeah, this is Greg McMahon, DDS. When I had a discussion with Peter, he had said that these safety nets apply to all settings, but I'm going to make sure that CCH has been thought out as part of that.
So Shannon Jacobino, DDS ombudsperson. Are there any other questions or feedback about the safeguards? Shannon Jacobino, DDS ombudsperson. I don't see any other questions or feedback on the safeguards, Greg. So maybe we can move to the next item on the agenda, which is discussion and feedback on the residential incentives, employment and day incentives, and then the transition safeguards. So if there's anything else that comes up for people around the safeguards, we can discuss it then. Does it make sense for us to maybe put the residential incentives up on the screen to give people a refresher?
Yes. Give me 1 sec. I apologize. I'm not having a very cooperative computer today, so I will put up residential first. Bear with me.
This is Shannon Jacobino, DDS. I'm Bud's person. I might be able to do it, Greg.
No, I think I have it.
You got it. Okay.
I mean, we did go, this is Greg McMahon, DDS. We did go through these last time. I don't know that we need to go through them in the detail we did. But we could scroll through if something catches your, that you think of as we just kind of scroll through each screen. You know, please raise your hand and comment, ask questions. So the first screen was, again, similar to the day of what settings people would move from and to, as was the second slide. Is there any comments or concerns on?
This is Shannon Jacobino, DDS. I'm Bud's person. Jessica Sundell has her hand raised.
Yes, Jessica Sandell, DDS. Greg, I was just wondering, the last bullet on this page, on page 3, indicates that moving individuals who have significant behavioral medical supports off the emergency list and into a vacant bed of a CLA or CRS. How is that defined? And I apologize if it's in the other very lengthy document and I missed it, but I'm just worried that maybe that's not going to be well defined enough for providers to know who that would apply to. That's all.
All right, this is Greg McMahon, DDS. I'm not sure I follow where you're going with that, but as part of a transformational plan, an agency may submit that they plan on moving some people who are pretty independent and could live in a cluster, for example. So they have a 4-bed home and 2 people may benefit by moving to a cluster. The agency then, either through PRAT process or by looking at our PRAT database where all the emergencies are listed, could follow our process for accepting emergencies into those homes, and they would receive incentive payments for doing so.
Okay, so just again, Jessica Sundell, DDS, just to be clear then, it despite the wording significant behavioral and medical supports, that we're not actually using that criteria and it would be anybody off the emergency list? That's what I was, sorry, because I think that part wasn't clear. That's what I was trying to ask.
Okay, yeah, this is Greg McMahon, DDS. That's the plan. Yeah. Are there other questions?
Shannon Jacobino, DDS. I'm Bud's person. Lena Esposito has her hand raised.
Yes, good morning, Jeff. I'm Lena Esposito for Connecticut Family Support Network. Then this is my question. Can we be a little more inclusive with the people that they are not going to be in the same cognitive level to live independent? Can we offer for them like a little transition training that we can bring it to this place and they can start training for the medication, for the kitchen, for all the stuff in order to make it a little more easy. If in the future maybe they can be a candidate for that, or we're just going to say no, you definitely are not going to be able to qualify for these kind of settings.
Yeah, this is Greg McMahon, DDS. Perhaps I didn't hear that very well. There was a lot of background noise. I did, but I don't know if Shannon did you get that?
Shannon Jacobino, DDS. I'm Bud's person. So I think with all of the settings that people could potentially move to, you know, in our in the presentations, we have asked about people who have higher levels of need and whether or not those settings would be appropriate. So I don't think there's any expectation that an individual would need to be able to be capable of independent living to be able to transition into one of these other settings. I think, you know, the supports would be in place to help people to develop those skills if in those types of settings. And I'm thinking, you know, specifically right now around the supported living model and the discussion around how people's level of independence has increased in many cases in that model. I'm not sure if I'm answering your question, Lena. Does that answer your question?
Yes.
Okay.
Lena Cusino, Family Support Network.
Yeah, and this is Shannon Jacobino, DDS and Buds person. So I think that an individual's level of need would not preclude them from being a part of a transition if the team, which includes the family, the individual, the provider, all felt that that was something that would work for that individual. This is Shannon Jacobino, DDS on Buds person. Are there any other questions around this slide? Are you going to continue to move through the slides, Greg, and see if that
Yes.
spurs any questions or conversation? And Lena, I see your hand is still raised. Did you have another question?
No, thank you.
Okay,
Let me
okay.
lower.
Is the, this is Greg McMahon,
This is,
DDS.
sorry, this is Shannon Jacobino, DDS on Buds person. Joanne Melise has her hand raised.
And again, I'm going to be that little gadfly. Last bullet, people with significant behavior and medical support should be able to move to a CCH as well.
Shannon Jacobino, DDS on Buds person. I agree.
This is Greg McMahon, DDS. Yeah, I'm just making note of that. Okay. So the next slide was reviewing the incentive payment around day for somebody who moves out of a congregate setting into a more independent setting. Talking about the agency receiving an incentive, the agency where they're leaving receiving an incentive, and the agency where they're going receiving an incentive for that. Any questions or anything on this? Comments?
Just Joanne Melise, Living Innovations Director. Just my usual one. Let's include CCH. You can add that onto every slide. Thank you.
So the incentives, the screen is about the incentives that the agency would receive, who are moving into the new non-congregate support. And it's 2 times the standard hourly rate. Okay, not hearing anything. And then the rest of this is our examples of what the slides above it. If there's any question on the examples, are the example, I guess another question on the whole, this whole slideshow, as well as the examples, are they understandable? Do you find them to be presented in a way that is fairly easy for individuals and families to understand?
Shannon Jacobino, DDS on Buds person. I don't see anyone with their hand raised.
Okay.
Can I make a comment? I'm sorry, I can't raise my hand because I'm only audio. This is Pat Tyler.
This is Shannon
it
Jacobino,
okay?
DDS ombudsperson. Go ahead, Pat.
Okay. If we're talking about the slides, like I would say that I don't think it's great for a family that's not pretty educated in the system. I think what works better are they, more than one example, and kind of written not just from what the agencies. It's slanted towards the effect on the agency, right? I think if you want this to be more appealing or more digestible to families, it would have to be written more as if it's the family reading it. Now it reads, to me anyway, as if it's written for an agency and you're trying to make it friendly instead of the other way around. I think frequently asked questions, many examples instead of like one example, all those kind of extra things I think would be helpful to making it more user-friendly from a family perspective.
Okay. This is Greg McMahon from DDS. Yeah, thank you, Pat. I agree. We agree. And actually, we began working. Actually, I drafted an initial FAQ at the end of last week that our communications person is reviewing and that we'll be getting out. In part because we already have one transition plan and we have to start communicating to families if plans are coming out. And so we're trying to kind of get a draft started that would be moving on to this committee and hopefully would be more understandable. But it included frequently asked questions as part of it and definitions a bit of all these acronyms that are included in the slides.
This is Shannon Jacobino, DDS ombudsperson. I think maybe once we get the draft reviewed, maybe giving the committee some opportunity to take a look at it and give feedback to see, because this will be hopefully something that's more digestible for families and doesn't get in so much into the weeds because, from my perspective, I think it's important for families to understand the financial incentives that are being offered to providers, but it's not, I think, going to be the most important thing on most families' minds. I think understanding how this could potentially impact their loved one is what's most important, and having an understanding of the process is important. And I think also for all of us, trying to, I think, give some feedback on what would motivate someone to want to be a part of this process would be, I think, helpful because the provider incentives are not necessarily incentives for families. And so I think being able to think about why would a family want to have their loved one be a part of this process would be useful for this committee to consider.
This is Greg McMahon, DDS. Are there any other questions or comments on the residential incentive?
Shannon Jacobino, DDS ombudsperson. Jerry Kogut has her hand raised.
Yes, this is Jerry Kogut, parent and a member of the board of Mid-State ARC. I just wanted to make the comment that I agree with Shannon as a parent and all what she had said for that.
This is Greg McMahon, DDS. Thank you for that. The draft that I wrote, was finished on Thursday, late in the day. We had some thought of trying to get that here for today's meeting, but with our agenda having as much on it, and it's pretty rough, the first stab. So we hopefully will have that for our next meeting as part of our agenda. Okay. And this is Greg McMahon, DDS. Shannon, do you think we should post the residential again for questions? Are there any, I mean, the day in employment, are there any questions that people have had since we reviewed it?
I don't see, this is Shannon Jacobino, DDS. I'm Bud's person. I don't see anybody with their hands raised. Although I'm wondering if, I mean, I'll leave it to the committee. Do you feel that we need to post it again? Do people have any recommendations regarding those incentives? And just really any thoughts overall on all of this? I mean, this is our opportunity to be able to, I think, communicate on behalf of individuals and families about what's happening with this process so far. And so I think any thoughts that people have, this is the time to put them out there. So Shannon Jacobino, DDS, I'm Bud's person. I see, first I'll ask Jerry, your hand is still raised. Do you have another question or comment, or is that from before?
Sorry, that's from before. This is Jerry Kogut, parent.
Okay. All right. Joanne Melise has her hand raised.
Hi, Joanne Melise, Living Innovations Director. You know, you've shared a lot of information with us, a lot of technical information. And I think that when we have a discussion as far as sharing it with the public and with families, we need to be very mindful of what do they need to know and how can we put it in human terms and not professionalism. People don't really learn much from PowerPoints. And I know that people need to hear things a whole bunch of times in a whole bunch of different ways in order to get it. And I think as we move forward, the more personal we can be in offering face-to-face, Zooms, in person, literature, you know, multimedia type of way without any jargon, without any abbreviations, would be of help. And not only to say in the beginning, hey, this is what a CLA is, you know, let's spell it out throughout the document or whatever it is we're sharing so people don't have to go back and reference. There's an awful lot of alphabet in DDS. And I would question how much they need to know about incentives that are going to agencies. Beyond that, this is making more opportunities for residential options for your loved one. Just some thoughts. People want to hear things face to face, person to person. And so statewide forums, integrating it that way, keep offering them. Thank you.
This is Greg McMahon from DDS. Adriana Ramirez just put a comment in the post saying, yes, 5th grade level language, simple language. And kind of going back to the beginning draft of our first, that we worked on, that was the goal, probably still too complicated in the draft we had. But I think moving forward, much of what Joanne was touching on are things I think we'll be working with our communications group on how best to communicate a message to people, because that's not our area of expertise. Adrienne also said she also thinks videos, short bursts of information are very easy to digest. I agree.
Shannon Jacobino, DDS, I'm Bud's person. Denise Palladino has her hand raised.
Denise Palladino, SD Director, DDS. In terms of, I want to kind of couple on what Joanne said about our messaging to individuals and families. I think that folks are going to be very excited about the additional opportunities for folks in the department's mission, is supporting people to have more independent, quality lives. But there's still a lot of hesitancy and challenges that impact changing the services and supports people have been so comfortable with, right? Especially around, competitive employment. the challenges around transportation and things as such. So I think in our messaging, it would be important to kind of hit upon maybe some of those challenges and some solutions to those challenges as we're messaging this stuff. And again, kind of coupling again what Joanne said, families and individuals are not going to be as interested in what the providers are going to be receiving in terms of incentives. They just want to know that there's additional opportunities and services for people. So I think if we kind of have our focus more about this is what we hope to offer, and here's some of the ways we could kind of avert some of the challenges and what we're putting in place to kind of help promote that.
This is Shannon Giacovino, DDS. I'm Bud's person. I agree 100%. And I think, I think understanding what all of the support options are. I know that the website isn't the only place for information, but I do think the website, having a place where people can go, where all of the options are laid out in simple language with, maybe the, short videos that we have of each of the providers explaining that service and, talking about some of the benefits and the challenges and who might, have difficulty in a certain setting, but giving people as much information as possible when we have success stories, putting those up so that people can go to one place and find all of that information laid out in one place in, a simple description with an opportunity to right there in that one place learn more if they want to by looking at the videos and looking at videos of success stories or how things work. So I think that that's really important for all of the service options, and I don't know where that exists right now or if it does exist right now.
This is Greg McMahon, DDS. I just you had some more comments in the chat. Adriana indicated written information and videos that are stories versus being taught to like a class. I might ask if we could silence mics again. There's some beeping coming in from the background. Thank you. So written information and videos that are stories versus being taught to like a class, and messaging in various languages with infographic comparing different services to make informed decisions, both for families and those guiding the families to be better informed. And also maybe to include a form for families and viewers of website to fill out to suggest ways they would like to better receive information or what they were missing. So you mean a website, sort of a survey of what's missing from our website, essentially? Adriana?
This is Shannon Giacovino, DDS. I'm Bud's person. Well, we're waiting for Adriana to maybe answer that question. Joanne Melise has her hand raised.
Thank you. This is Joanne Melise, Director at Living Innovations. With profound respect for DDS, I want to make sure that there's a component in this when explaining things and different programs and services that there's significant turnover, that all case managers and referral folks are updated on services and eligibility and understanding the initiatives in terms of making movement to less restrictive environments. And I say this with, again, profound respect, but an experience of a lot of case managers not really understanding about CCH as a viable opportunity. Thank you.
This is Greg McMahon, DDS. One of the, I mentioned at the beginning of the meeting that we are going to be having an initial meeting with McDowell to talk about that need for consistency and messaging across both areas for DDS staff. That's the DDS Engagement Committee. Because you're right, we don't have a great history of communicating consistently to all of our staff in order to help families. So we want to have the same messaging come across for and be consistent, so that the message our DDS staff are getting is the same message that our individuals and families are getting, albeit maybe in different forms. And perhaps the DDS staff will need to have more information to be able to answer questions. So that's the goal of this combined meeting of the chairs, to say, how are we going to be on the same page and make sure we're communicating consistently.
This is Shannon Jacobino, DDS Ombudsperson. I see Mayor Cruz has her hand raised, but to Joanne's point, I think that that's also one of the reasons why it is so important for us to be able to make sure that we are working with the consultants to make sure that we have a good communication plan, and that, you know, in addition to having information that is understandable and digestible to our community, also how we are going to more effectively be reaching out to people that we don't that don't get the information necessarily, who aren't tapped in, because I think it's really important for people to be informed advocates and to know what to ask for, so that we don't have to count on the system always being exactly where it needs to be, that we have to do all of those things. The system has to catch up, but people also need to know what to ask for, and they need to know how to ask for it and how to push for what they need. And so I think that our committee can be really helpful in being able to make sure that we're doing the best job that we can to make sure that that happens. Mayor Cruz has her hand raised.
Maricruz Ortiz, Benford, Connecticut. I apologize, my camera is not working, but I did have a recommendation. I think it'll be important for families considering new services, probably link up with other families who have gone through the process, coming from a CLA or CRS to a CCH or CRS, and sharing the success stories and sharing some of the struggles. I think that will mean a lot for family members. We DDS and providers try to do a good job, but I think coming from somebody who went through the experience will be greatly appreciated.
This is Greg McMahon, DDS. Yeah, that's a great idea. And incidentally, your camera is working. Yeah. So you know you are on camera.
Okay.
This is Shannon Jacobino, DDS Ombudsperson. Is there any other thoughts or feedback that anyone has right now?
Greg McMahon, DDS. I think someone's typing.
I see that. And while we're waiting, I do want to let you know that I have asked that maybe we could have a Teams page set up so that the committee has the opportunity, even when we're not meeting, if something occurs to you, or if you have thoughts or ideas or things that you think should be a part of our recommendations, that there's a place where we can kind of keep a running list of those things, so that we don't miss anything, but also so that we can maybe have a more meaningful discussion with the consultants when we're able to do that. I see that. Oh, sorry, Greg. Go ahead, Greg. Sorry.
Greg McMahon, DDS. As Shannon was talking, I was getting a little message through email that the IT just set up that Teams page. So it's already up, and we have to figure out how to use it now. But that was just established like 10 seconds ago as you were talking about it, Shannon.
Excellent. This is Shannon Jacobino, DDS Ombudsperson. I see that Lena has her hand raised.
Yes, Lena Esposito, Connecticut Family Support Network. What I was going to say is that this is an enormous, big trust that the families are going to have to transition the loved ones to a setting that it doesn't have the overnight, then I definitely agree that the families has to have more information and try to be sure that this is the program that they wanted. Because as a parent, I would be concerned. Thank you.
This is Greg McMahon, DDS. I think those kinds of issues about if again there was a fair amount of background noise, but the the idea behind overnight supports and individual supports that a person with higher need might need would all need to be spelled out, addressed, and accepted in the transition plan from the agency, and that would include how they would do that. So the agency would need to say, for this person who needs overnight support will be provided in the following way, in a way that meets the health and safety needs of that individual and is satisfactory to the individual and family. It will be, that will be individualized, we anticipate, both in the there'll be a transformation plan from the agency saying how they're going to do it overall, and then the individual plan would need to address how that's going to be managed to make sure the person's in a good place. And that might be through the use of assistive technology. It might be the need for staff. It might be any number of things, but that would need to be spelled out in the plan.
This is Shannon Jacobino, DDS on Bud's person. Adriana has put a question in the chat. Are the 200 individuals that will be chosen include all lawn levels?
This is Greg McMahon, DDS. That will be individualized within the plans provided by the agency. So I don't think we know at this point what lawn levels they will be. One agency may look at a group of people with higher lawns that they have a good plan for to provide them more independent setting, and another agency might look and say we have people who are ready to go out the door with a lower lawn, ready to work competitively. That will be all part of the agency's transformation or transitional plan.
This is Shannon Jacobino, DDS on Bud's person. And I do want to add that, our committee is focusing on ARPA, but I think all of the information that goes out and gets put on the website and all the education that we do, I think will be helpful to families in advocating for what their loved ones need, because these supports are not limited to this transition. These are supports that are available through DDS. And so whether or not your loved one is a part of this transformation process, you can ask for the kinds of supports that you feel that your loved one needs, whether or not it's through this transformation process. So I hope that is clear. There's no support that's being identified that isn't a support that DDS doesn't already fund, and that there are agencies that don't already offer.
This is Greg McMahon, DDS. Are there any other questions or comments? So we have McDowell's here as a member of the public listening into today's meeting, which I think is great because they've heard a bit about the concerns and questions and presentation modalities and all the things that I think we want to seek their input on. And I don't want to set them up for something they may not be ready for, but I'm following this meeting, I'll inquire as to whether or not they would be able to come to our next meeting, perhaps, and talk a little bit about what they've heard today. And I apologize to the McDowell folks. We pretty much have to follow the agenda as posted, and we didn't have you on it. So that's the reason why we'll be waiting for the next meeting.
Hi, this is Becca Brockway from McDowell Communications. That sounds great. Thank you.
This is Shannon Giacovino, DDS on Bud's person. Do we have any more discussion or feedback before we move to the next item on the agenda? Okay, I don't see any. So the next item is that we only have one more meeting scheduled, and we obviously have a lot more work to do. So what I'd like to do is to send everybody the schedule for meetings, maybe going through at least to the end of December, possibly into January. I don't know when our work will be included, but I want to get that schedule out to everybody, and we will just keep to the same schedule. I realize that it may not be the most ideal time for everyone, but it was the time that the most people were able to agree to. So unless anybody has any objections, that's what I'm proposing that we do. I see that Dr. Ellis has her hand raised.
I apologize for the delay. I was trying to get it up when you put questions. This is Cheryl Ellis, Director of Diversity, Equity, and Inclusion. I just wanted to follow up on some of the recommendations around presentation to parents, but also ask or make a plea that have it available in other languages, and if there's any way to at least look at some of our more prominent language speaking individuals that have that available.
Yeah, this is Greg McMahon from DDS. Absolutely right. We do have to include other languages. And I think the other challenge that may or may not relate to that is reaching out just to hard to reach families in general. Figuring out how to reach those folks that we have a hard time getting involved, and so communications that have to be able to get out to all folks who are hard to reach for us or who we have a difficult time communicating with, I think will be very important.
This is Shannon Giacovino, DDS. I'm Bud's person. I'm going to move back to the scheduling of the meetings, and there is a question for me to repeat what I just stated about our next meeting time and day. So our next meeting time is Monday, November 21st. We're currently on a biweekly schedule. We meet every other Monday from 10 a.m. to 11:30 a.m. And what I'm proposing is to just continue with that schedule. So our next meeting is on November 21st. And then the following meeting would be 2 weeks after that, from 10 to 11:30. And my proposal is just to continue with that schedule, possibly through the end of January, just to make sure that we have, enough meetings in advance for people to be able to plan around that. Does that make sense? Does anybody have any other questions about that or any other comments or alternatives?
Yeah, this is Greg McMahon, DDS. As the new year comes, I'm going to be approved to work less hours per week. So I'm going to have to try and work around that. I'm only approved as a retiree to work a certain number of hours in a calendar year. And I will have less to work next year, so I might have to get creative around our schedule. But I'll talk to you, Shannon, I think more about that.
Okay. This is Shannon Giacovino, DDS. I'm Bud's person. So I think we can move on to, I don't know, I guess we already covered the announcement of our next meeting, which is Monday, November 21st at 10 a.m. And then the next item, Greg, is adjournment. So if you want to do that part.
Yeah, this is Greg McMahon. This is Greg McMahon, DDS. I see Joanne has her hand up.
Yes, just the Joanne Melise Living Innovations Director, sorry. being mindful of Greg's time limitations, does it make sense for the November, the next couple meetings to maybe go a little longer, to go to 2 hours?
This is Greg McMahon, DDS. I'll still be available for meetings. It's just I'm not 100% sure of the day. These meetings are, and I'll be going through the whole next year. I just have my schedule, my daily working schedule is going to change a little bit. So we'll just have to, I'll work around it. We'll make it work. But I may see if we can do a different day. But if we can't, these meetings are important. So I'll be attending them. So I believe we're ready to move on to adjournment. Does anybody want to make a motion to adjourn?
Joanne Melise, Living Innovations Director, I make a motion to adjourn.
Do I have a second?
Lena Esposito, Connecticut Family Support Network.
Thank you. So all those in favor to adjourn?
Aye.
Anybody
Aye.
opposed? Okay, thanks. Anybody opposed? All right.
Unless they want to keep, sitting on for hours on end, I don't think so.
All right. Bye,
Thank you.
everyone.